anyone doesn't want to be seen in the recording, yeah, you can hide your video and you can change your name. It will only really record whoever's speaking anyway, and the presentation slideshow that we have. So I think that's it in terms of all of the technical things. So I'm going to hand over to our host, Abigail Wood. Over to you, Abby.
Thanks very much, Marvin. And thank you very much, everyone, for joining this event today on this really, really important issue. My name's Abby Wood and I'm Chief Executive of Age UK London. I've seen a question in the chat about timings for today. So just so everyone knows, we're going to have this session running until 22, then a 5-minute break, then 45 minutes in the breakout sessions, then we'll come back for the closing session. I think it's really fair to say that many organisations working with older people have identified food insecurity as a long-term issue that's been both exposed and exacerbated by the coronavirus pandemic. Certainly Age UK's in London, who provided vital support throughout lockdown and beyond, have consistently been reporting that access to food is one of the biggest challenges facing the older people that they support. They've also reported problems in accessing food as a result of patchy provision, barriers caused by poverty, by learning difficulties and cognitive impairments, and also barriers caused by digital exclusion for those who need food deliveries. In this first session, we're going to be hearing from 2 speakers who are going to be talking to us about 2 really valuable pieces of research and what makes both the research that was carried out by the GLA into food insecurity and by Sustain into Meals and Wills provision so valuable is that both of them began before the pandemic really hit, but then they continued the research throughout that time. So they're able to report on the impact that time had on older Londoners' access to food. First, we're going to hear from Helen Moore, who's going to be talking to us about the GLA's research, and then Morven is going to be talking to us about Sustain's research, and then there'll be some time for some questions before we finish this session. So Helen, over to you.
Hello. I think, Marvin, do you have my slides or should I just present from my computer? What works best for you?
I do, yes. I'll just get them up. One second. Absolutely fine. It always takes a few seconds for me to just change things over to share screen.
No problem, that's fine. Great, thank you so much. Okay, so thank you so much for attending, everyone. So yeah, my name's Helen. I'm a researcher at the GLA, and I'm going to talk you through the qualitative research that the GLA has undertaken recently with our food policy team, exploring experiences of food insecurity amongst older Londoners, both before and during COVID-19. Okay, so next slide, please. So. Perfect, thank you. So just a little very quick bit of background as to why we chose to do this research. As we've heard from Abby, anecdotally, there has been a lot raised recently about food insecurity amongst older people. But what we find is that the formal research often focuses on economic hardship as the main cause of food insecurity. But actually, especially when you look at the older group, this older group of people, there are other factors that we need to be exploring. So an inability to physically get to the shops or access food, an inability to prepare food due to sort of a lack of manual dexterity or health conditions. Secondly, we chose to do the research because a lot of the previous research out there focuses on the reasons for food insecurity and policy measures, but doesn't really explore the lived experiences of this group. So certainly there's a lack of qualitative research looking at food insecurity amongst older people. And thirdly, it was a very timely issue. So we'd actually planned to do this research prior to COVID-19, and then the pandemic hit, and we thought this would be very interesting to look at because shielding will have created a situation where a lot of Londoners who weren't previously food insecure are now unable to leave the house, and they've really had their access to food curtailed. Okay, next slide, please. So very briefly, the research objectives. So what we hoped to find out with this research were the causes of food insecurity amongst older Londoners, the experiences. So how do people experience food insecurity, and what impact does that have on general well-being? And sort of separately to COVID, the extent to which the diet and water intake of older Londoners are monitored and discussed, and the extent to which older Londoners understand their nutritional needs and they're concerned by their nutritional intake. And next slide. So we did this through phone interviews. So we spoke to 16 participants in total. All of these were recruited via a fieldwork agency. There were 45-minute interviews. That's actually a typo. They were conducted from Monday the 22nd of July to Wednesday 29th, so last period of July, just as we were leaving lockdown. And we spoke to a range of Londoners, so all of them had to shield, but whether this was due to age or health conditions was mixed. A range of ages, a range of food insecurity, so around half were food insecure prior to COVID-19 and half were food insecure as a result of COVID-19. And in addition to this, there's a mixture by disability status, so households, so who they live with, if they receive government parcels or not, dietary restrictions, location, ethnicity and gender. Okay, next slide. So I'll just talk you through what we found out about food insecurity during COVID-19, first of all. So, next slide. Perhaps unsurprisingly, we found that COVID-19 has had an adverse impact on older Londoners' access to food. So whilst none of the Londoners that we spoke to went without food during lockdown, several were extremely worried that they might, as it was so difficult to access food during this time. The majority that we spoke to had shopped online before, so at least were familiar with the process. But as we've seen from Jackie's video, accessing a priority slot was extremely difficult, and it could take several weeks to do that. Instead, people were piggybacking on orders placed by their friends or family. They were perhaps getting friends or family to shop for them in person and deliver the shopping. But that has issues in itself, because people don't always think of the practicalities when they're shopping for someone else. So, for instance, we had one respondent who was diabetic, and whilst he was very grateful for his daughter doing the shopping for him, she actually bought the high sugar items when he would have bought low sugar items. We had another respondent who lives on her own, and she said that people would buy her things, but they wouldn't think about the sell-by dates. And actually, if you're living on your own, it takes you a while to get through food, so it's really important to have that long sell-by date. We also saw from Jackie about the expense of shopping online. Products might not be in stock, and actually a lot of cultural foods are not available online, so people perhaps couldn't get the kosher meat, or they would have to ask friends and family to drop this off for them separately. We found that whilst people were grateful for government food parcels, the food wasn't actually adequate often to create a kind of a balanced meal. And especially we found with those that were diabetic, the food could be quite starchy, a lot of white bread, a lot of sugary items. And we also found that one person who was arthritic mentioned it was very difficult for him to open the tinned goods in the food parcels. So all of these issues meant that for many older people during lockdown, there were changes in their diets, and in some cases they were actually limiting their food consumption because they weren't sure when they were going to be able to access more food. Okay, next slide, please. So just a couple of quotes here that illustrate how people's priorities shifted during lockdown, from managing the diet to sort of eating whatever food was accessible to them. So we've got our first quote from John, who's a diabetic, where lockdown was just sort of this period of panic, and it was like, I couldn't get onto the priority list straight away. So I was just eating frozen fruit and veg, and I was eating whatever bread I could find, even though it was white bread. And I'm a diabetic, and I know that I shouldn't be really eating that. I just need to eat rather than manage my diet at the moment. Similarly, we've got a quote from Ruth on the right, who's saying because she's now doing online shopping, she's having to make do with whatever's available rather than buying, rather than actually choosing what food she wants to eat. Okay, so next slide. Additionally, there was an evident social impact to lockdown, which shouldn't be overlooked. There was a lot of anxiety before lockdown officially happened. A lot of the people we spoke to were shielding themselves and it started to prepare for COVID. So they weren't going out, but they were having to do this without government support. So they were having to do this without the priority online slots, without the government boxes, which is very difficult. And there's a lot of uncertainty surrounding this period. And secondly, we found that shopping is actually a very important assurance of autonomy for everyone, really, not just older people. And many were using their weekly shop or their daily shop to as a chance to get out and about and provide some structure to the day. And this was then taken away from them. It's actually a very important exercise of autonomy, being able to choose your own food. We shouldn't forget that. And thirdly, neighbours, whilst we were grateful for help, they often restricted their offers to practical help. And actually, it's very important that we stop and chat to people as well, especially for those who are living on their own. This time could be very lonely. Okay, thank you. Next slide. So this is just the findings that we found from looking at food insecurity more generally amongst older people. So next slide. So we found that the majority of respondents tend not to meaningfully discuss their diet with healthcare professionals, and they aren't really asked about what they're eating when they're attending appointments for other health issues. So the one exception is diabetics, because they tend to have diabetic clinics where they would be discussing their diet with healthcare professionals. And there was actually another man that we spoke to who'd had a heart bypass. So for those that have had health issues that are linked to diet in the past, we found that some of those were actually healthier now than they were when they were younger. But for the majority, they wouldn't really be discussing their diet with anyone. They might discuss with their family. Family might say, "Oh, do you feel that you're eating enough?" But that's when it would sort of end. It wouldn't be a discussion around what are you eating and when are you eating it. And it's very rare that the older people that we spoke to would be discussing their water consumption with anyone. We also found that there was quite little consideration about why diet might have to change with age. So some of the people we spoke to questioned why their diet would need to change, so long as they were continuing to eat healthily. But then we think of healthy as being low sugar, low fat, lots of fruit and veg, which actually isn't necessarily the kind of thing that you should be thinking about as you're growing older. Factors such as bone density and the impact of diet on certain health conditions such as arthritis weren't really very widely mentioned. Okay, next slide. One of the main predictors of difference in diet that we found was household size. So there were quite distinct differences in diets between those who live alone versus those who live with others. It could be due to other factors such as age, but yeah, there was definitely a difference between household size. So reasons such as I can't be bothered to cook for one, I'm living on my own, so there's no reason for me to stick to meal times, and cooking for one requires multiple ingredients, which can lead to food waste. All these things sort of contributed to those who live on their own perhaps having a less healthy, a less consistent diet than those who were living with someone else and who could share the experience of a mealtime. We found as well that mental health conditions such as loneliness may impact appetite. So I spoke to one respondent who, since losing her husband, She says, I just eat junk and snacks rather than cooking meals. And obviously such mental health conditions aren't limited to those living alone, but it can be difficult to spot symptoms when we're not living with someone else. Okay, next slide. And we found that coping mechanisms are evident amongst those who are food insecure. So those who sometimes struggle to shop for or prepare or eat food prior to COVID-19 due to health conditions, perhaps. We found that they're employing mechanisms to get around that. So I spoke to one lady who was choosing softer foods because they're easier to chew, but that does limit the variation that you have in your diet. I spoke to a man who's arthritic, so when his arthritis isn't flaring up, he will batch cook. And a couple of people who have COPD, a respiratory condition, so when they're unable to leave the house, they will stockpile food. They'll stockpile food for when they're unable to leave the house. And there is a potential danger, therefore, that people come to rely increasingly on these coping mechanisms, and they fail to realise that they're becoming more and more limited in what they can do and what they can eat until it could be too late. The potential risk here is compounded by the fact that many older people fail to discuss their diet, certainly in any great detail with others, and there's a real lack of awareness of the support available, both generally and amongst those who are slightly more vulnerable. Okay, so next slide. And this is just about the lessons that we can take forward from our research. So things that we found that are sort of good to think about in terms of how we can improve the situation. So firstly, even as lockdown lifts, many are still anxious. Our research was conducted in July 2020 when lockdown was being lifted, but this anxiety may be even more prevalent now as we teeter on the brink of a second lockdown and no one's really sure what's happening. I had a couple of respondents say that they would appreciate a vulnerable hour in supermarkets, which would mean that they didn't have to online shop and they could go and choose their own fruit and veg, but they were doing so in a sort of shielded space where everyone was very respectful of social distancing. The vast majority we spoke to are not really planning on going back into shops soon, even though they prefer it to online shopping. They just don't feel safe. But it is important that we keep face-to-face shopping as an option. As we've seen, it's very valuable in enabling independence and autonomy. Thinking widely, it's also, so thinking outside of the group of older people, it's also important that those who interact with them are aware of the support available, and that we ask older people more about their diet. So encouraging this discussion of diet with friends and family, including water consumption. And also for those of us who perhaps offer support to older people, understanding that support is not always practical, but it's very often emotional, especially now when it's such an uncertain time. And also all of us being more aware of the support that is available to older people, both during COVID and more generally, so we're able to advise on that. And yeah, thank you. That's the end. Thank you very much.
That's wonderful. Thank you very much, Helen. I think what was especially powerful about that was seeing in older people's own words exactly what they'd been experiencing and how things have been for them. So now I'm going to pass over to Morven, who's going to present her latest piece of research.
Brilliant, thanks very much. I'm just getting the sharing screen up again, and there we go, that should be working. Thanks for that introduction. Yeah, so my name's Morven Oliver Larkin, and I work at the charity Sustain on our London Food Poverty campaign and Older People's Food campaign. So my research was a small qualitative project looking at Meals on Wheels services in London. Like Helen's research, I actually started prior to COVID-19, and then when COVID-19 happened, I was in the midst of my research and kind of changed some aspects of it as I got onto. You can download that research paper on our website, and we'll also send it round after the event. In this presentation, I'm going to give an overview of how I did the research, some key findings from it, and the recommendations that I made as a result of those key findings. So the research itself involved predominantly interviews and ride-along visits and site visits. So this was focusing more or less on Meals on Wheels services, although I did also speak with people involved in other types of food services for older adults in London. So I spoke with service users themselves, as well as older adults who didn't have services available in their local area. I also spoke with people commissioning services in local councils, people running these services in local councils, and people who are involved in actually running them on the ground, so delivery staff, service managers, and so on. As I said, I also spoke to some people involved in related services, such as shopping services or lunch clubs. Lunch clubs, I think, are a really important kind of complementary service to Meals on Wheels, because they provide a community-focused place where people can go to eat together, whereas Meals on Wheels is much more about being able to eat safely and healthily in your own home if you're not able to cook for yourself regularly. So just before I get into kind of the findings from the research itself, some context to this research is that Meals on Wheels services across the country over the past 10 years have been cut back quite a lot, along with other cuts under austerity policies. So in London, this is quite drastic. Fewer than 10 boroughs now provide a Meals on Wheels service out of 33 London borough councils. And so this kind of creates a postcode lottery in terms of what's available for people who need this service. Another piece of context behind this is that people over the age of 65 are at very high risk of malnutrition. It's a demographic that's at the highest risk of malnutrition. So that's kind of the context in which this research was situated. That's just one of the delivery drivers for one of the services that I did some of the research with. So as I said, I started my research with more established services before COVID-19 hit, and some of the key findings from that research itself. The first thing to say that was quite interesting is that there's lots of different reasons that someone might need this type of service. I don't think it's true to say that everyone over a certain age would need this service at all. There's actually a breadth of types of people who benefit from the service. By and large, those who do need the service are people who struggle to do food shopping or to cook at home. This can be due to disability, health, age, mental health issues, or often it can also be recovery from a time in hospital, recovery from a fall. And by and large, people who do need the service kind of fall into two categories, one of which is some form of recovery to enable people to get back on their feet when they're not doing so well. And for other people, it's a permanent service that they're using, and this enables them to stay in their own homes and not need residential care settings for a lot longer. Yeah, after that, I also saw that in a lot of the places that I was going to, the services provided this more than just a meal approach. And this is a really, really important aspect of these types of services. They included welfare checks, and they also linked up with adult social care services. So the delivery drivers were brilliant people, and would be just checking in with people daily, providing that regular social contact, and then also if they sort of spotted that something was a bit off, they'd be checking in and then reporting that back to head office if someone seemed like their health was deteriorating in any way. So it can be a really beneficial thing, not just about the nutrition itself. And a lot of them also linked with a lot of kind of related services like active aging or nutrition screening, so provided that wraparound support. Interestingly, in terms of how people viewed this service in councils where this was being commissioned or run, there was quite a large consensus that this is a really beneficial service that has a strong preventative benefit, but that a lot of people within councils were having to make really difficult decisions. So they understood that, you know, having a Meals on Wheels service can help people to stay healthier for longer, and this can reduce costs for to the NHS, and that it reduces the number of times that ambulances might have to be called out for falls, the number of GP visits, all of this kind of holistic preventative support. But because of the way that budgets are often kind of segmented into different streams, those cost savings to the NHS weren't seen by adult social care, say, and adult social care might be actually paying for this type of service. So people often felt like it would be good to maintain this service, but because there's no statutory obligation to maintain it, it's just too difficult in terms of the pressure that they're under to cut budgets. So that was interesting in terms of speaking to people in local authorities. And lastly, as well as all of the benefits to people who are actually receiving the service, the jobs that they created seemed really brilliant. I had the pleasure of doing a few ride-alongs with delivery staff, and it was clear that the workers I spoke to really loved the work that they were doing. Many of them had worked in kind of lower paid retail jobs or cleaning jobs, and they spoke about being treated not very well in those previous jobs, whereas the work that they were doing here, they felt like they were part of a team where everyone was working towards something valuable that helped society, and they felt that they really appreciated the work that they were doing. So it created good, meaningful jobs in lots of local areas. As I said before, COVID-19 happened in the middle of my research, and so I carried on doing interviews and site visits. Well, I stopped doing site visits, but I carried on doing telephone interviews with people in existing services, but I also then started doing some interviews with people in these new services that were emerging in response to COVID-19. So this was mutual aid groups or existing voluntary and community sector groups that had been doing maybe community lunch clubs or cookery classes, and then they changed to a hot meal delivery service due to COVID-19. From those conversations and interviews, some of the key findings that I saw were that there was some difficulty in getting the referral pathway correct. So there would be a lot of people who wanted to set up a service, they saw this need, but then they found it hard to reach the people who actually needed it best. And I could see that when this worked really well, it was either that group was really well embedded into the local community and had links with people who might need the service, or they were linked up with adult social care teams, hospital discharge teams, or local Age UK branches. I also saw from some of the kind of more ad hoc DIY community groups that sprang up that there was at first quite a reliance on volunteers and on surplus food, and that seemed quite difficult for a lot of the people who were running these services to maintain in a sustainable way. With surplus food, it can be quite hard to know what you're going to get week by week, so they actually shifted then to buying food in so that they could have a consistent and healthy offer throughout. And also reliance on volunteers, whilst of course it's volunteers can have a great role in these kind of services, where it was wholly volunteer run, so coordinators, chefs, that kind of thing, people who'd been on furlough were playing those integral roles. That was really difficult to sustain as well. Although there were some setbacks with these informal models, I also saw that for a lot of people, it felt, for a lot of people receiving the meals, it felt more like you're part of a community who's helping one another out rather than the recipient of a service. So that could reduce some of the stigma that can be associated with some of these services. So just quickly then on to the recommendations that I made coming out of this. So in the short term, and kind of at the more localized level, I think one thing that really can be helpful across the board, if there was a streamlined and standardized referral pathway, where services are really supported to be able to be linked in with adult social care and hospital discharge teams, and that this was kind of standardized across the board, because there was a real difference in some services were inundated with referrals and some were really struggling to get referrals, and that wasn't really to do with demographics. I think that was to do with the way that referrals were happening. I also saw that where services operated at a slightly larger sort of economy of scale, they were able to work better. So having services that exist across a few boroughs can be really good. And of course, just the funding for any new provision that is springing up. A lot of the new services that I saw were not going to be able to continue in a way without funding, as it was a little bit on a shoestring, so they were looking for more permanent funding. And in terms of longer term recommendations, I think something that's absolutely vital is some kind of a statutory requirement on local authorities, so that people don't feel that their hands are tied and that they have to cut this service. I think that this should be quite broad, so it should be something where it's a statutory requirement to ensure that all older people can access at least one good meal per day, and that kind of leaves room for this to be done through Meals on Wheels services, through lunch clubs, and other community efforts. But Meals on Wheels would play an absolutely vital role within that. And of course, if you place a statutory requirement on local authorities, there needs to be adequate funding for that local authority. And then I also think in terms of evaluation mechanisms, looking at budgets in a kind of longer term holistic sense, and seeing that, oh, these cost savings to the NHS are actually coming from this funding that we're using here in adult social care, say, is would make councils more able to justify funding these. So yes, thanks very much for listening. That's me. That's a little bit about our campaign, and if anyone wants to get in contact with me afterwards and has questions. So yeah, that's me. Back over to you, Abby.
Yeah, thank you very much, Melvin. That was absolutely fascinating, that research. I've also seen there's loads of really great comments in the chat function. We're supposed to be going for a break now, so I'm going to suggest that I just pick up on one question, because this really stuck out to me as an interesting one. The question, to I think both to you, Morgan, and to Helen, of was pride an issue in terms of people asking for help or feeling that they couldn't ask for help? Is that something that either you or Helen picked up in carrying out this research?
Would you like to go first, Morgan, or shall I?
Sure, yes. I think it was, yeah. I think that definitely was something that came into it. And like I said, with the community-run services, where people felt that they were part of decisions being made, and that this was part of a community of people who were helping one another out, I think that could help to really overcome that, or to see this for people who did. I spoke to some people who really saw the Meals on Wheels service, for example, as a way for them to be able to do other things and have energy and strength to meet their grandkids and just to do these other things in life that really, really matter. And I think feeling that pride in, you know, I deserve at any age of life a good quality of life and connection with my family, and if these services are here to enable that can help to overcome it. But I also think that there were people that I spoke to who did feel they felt sad about needing to use this service, and they felt that I think that pride did come into it. So yeah, it's a complicated issue for sure.
Yeah, thank you. Helen, is that something that you saw in the research?
I'm not so sure if I saw pride being an issue, but certainly I think people kind of normalise what they are and aren't able to do. And if you're very slowly deteriorating, that becomes quite problematic, as you start, well, we saw it in the slide about coping mechanisms. You might start to use more and more coping mechanisms, and you might not realise that actually some help would be really beneficial here. So that is sometimes, I think, if the help isn't being proactively offered and you're not exactly sure how it can, what benefit it would bring to your life, it might not occur to you to try and seek it out. And also there's the issue that people don't really know where to go. So I think perhaps that normalisation, and maybe an element of pride is incorporated into that as well. Yeah.
Thank you. That's really interesting to hear that. We're running ever so slightly over time. We're supposed to have a quick break now. I just want to check with Simon, who is sorting out the tech side of things, whether we're all going to be automatically put into our appropriate breakout sessions at 2:45 on the dot, or whether it's possible for everyone to take a 5-minute break and then move into those sessions at 10 to.
Yes, that's a very good idea. There are just a few people who I don't know which group they want to be in, so they will just stay in. When I activate the breakouts, they'll stay in plenary and I can just check with them which group they want to go in. But most people will. A pop-up box will come and you just have to click on that. So we can stay in plenary until I activate that if you want, Abby. Up to you.
Just we do that so everyone can have a quick 5-minute break, get yourself a cup of tea, stretch your legs very quickly, and then we'll come back at 10 to, and as Simon says, the box will pop up on your screen to take you into the right breakout session. So just very quickly, we want to say a big thank you again to Morven and Helen for some really fascinating research. I saw lots of comments in the chat that people really like to see these reports, so I assume we'll be able to send them out to everyone so that they can see the detail. Brilliant. Thank you very much, everyone.
So many of us, it's hard to get any verbal feedback from everyone. So we're going to go to, I'm just getting it up on my screen now. If everyone could just go, and just a reminder, if everyone could mute, just so there's no background noise for everyone. If everyone could just go to menti.com. You can do this on the device that you're on, or if you have another device as well. If you need to escape out of the Zoom window on the device that you're on, that's absolutely fine. You can do that, and it should still just run in parallel. So you want to just go to www.menti, so MENTI.com, and then you'll be asked for a code. And basically this is a way that we can all visually feedback from the sessions that we've just had, so we can hear a little bit about what other people were speaking about in the session that we didn't get to go to. So you'll put in the code 6102565. It'll show up. Sorry, my slides are being funny. It'll show up on the screen that I'm about to share as well. So hopefully everyone's done that. If anyone joined a little bit late, it's basically going to menti.com and then putting in this code 6102566. So I'm just going to go there and take us there now. Bear with me while I sort the technology out.
Sorry, could you repeat the code? I've lost it.
Oh, it's, I'll get it up visually as well, but it's 6102565. I will get it up visually as well because that can be a little bit confusing. 1 second. So, yes, here we are. That's brilliant. So the code should be up at the top of the screen as well for anyone who wasn't able to see it. So that should be there, 6102565. And the first question was just something quite simple about what were the key takeaways from your session. And it brings up everything that people are saying, and the words that are bigger, quite a lot of people are saying. So the more people that say them, the bigger the words get. So the ones that are sticking out clearly are funding, collaboration and sustainability, and connection and nutrition. So that seems fitting considering everything that was going on in the morning and everything that we heard. Funding is just staying there right in the beginning, right in the middle. I love that broccoli has popped up too, so that fits with nutrition, I suppose. Having fresh fruit and veg is really, really important. The sustainability of services, I think sustainability is probably coming up in relation to how do we make sure these services keep going. There's quite a lot going on as more people put things in. Partnerships, working together is really important. The importance of culturally appropriate food for people. Conversations, social connection. Yeah, that came up in the session that I was in as well. I'm sad that I couldn't go into the other session. That would have been brilliant. So there's still a few more coming in, so I'll just wait until our next slide quickly. Sharing information, so that relates to the partnerships and working together, I think, and that was quite important from my research as well. Resilience came up as a big theme in our session. How can we promote the resilience of older people as individuals and within communities? Better understanding. Yeah, there's some really great stuff, and we'll share all of these slides at the end as well. So I'm just going to move us on in terms of time to our next slide. If I can do that, okay, there's quite a few things on my screen, and that should take you all to the next slide as well. Oh, there we go. Perfect. So hopefully you will get a new screen now as well, where the question has come up, what do you think needs to happen? I can't actually see it now, apologies. What do you think needs to happen next to ensure good food for all older Londoners? So it would be great just to have people's feedback in terms of what you think needs to happen, and that should give you an opportunity to feed into that. So we'll just start seeing people's responses as they come up. Link adult social care with NHS budgets. Better communication across services. So a lot of working together and joint work is definitely coming out of this. And then policy change at city or national level. There's a lot of stuff around integration between different partners working in this field, how we integrate budgets, how we integrate different people and the ways that they're working together. And then there's stuff that's not about the government as well, but also around how people can learn to be more in touch with their own health, self-screening, getting family and friends on board with this as well. Yeah, there's a lot of things around clear referral routes, making sure that Meals on Wheels are a statutory obligation. I would definitely agree with that one. That's an interesting one. Duplication of food support efforts and distribution methods meant that there were gaps or inefficiencies. So in some places, I suppose there isn't a service at all. And then in other places, maybe there's duplication. And I suppose that relates to the communication and partnership working that we were talking about before, and how important it is for people to, for people who might need services to know about them, but then for people delivering services to actually be communicating with each other as well. And from a lot of the research that I've done, I think there's a clear kind of, even if everything isn't directly provided by the council, there is a clear role to kind of oversee and be a conduit for information. For the council can really helpfully play that role. Better understanding of the diverse needs of older people. Yeah, that was something that came out in our session as well, around how you kind of need an ecosystem of different types of support, because not everyone needs the same thing at all. A Meals on Wheels service isn't what everyone needs. There needs to be lots of different things available, and there needs to be some understanding of what lockdown has actually been like for a lot of older people, and what their needs might be. It's brilliant to see so many answers coming in. Thank you so much for everything that you've added. I think we can share these at the end. We can definitely share the word cloud. I think we can share this, but we are going to do a write-up and share the initial recording, as well as a write-up of what came out of the sessions. So there will be something that you can share more widely afterwards. Just while my screen is still sharing, the kind of in our sessions and in some of the research that's come out and in some of these bits of feedback, there's been a real emphasis on collaboration, on people working together, and on sharing best practice. So Sustain, I hope you can all see this, but that's just one of our web pages around our older people's food campaign and the work that we do around Meals on Wheels and other aspects of improving food for older people. What we also have, so you can go to this webpage and I'll put it in the chat afterwards, but we also have an email forum. So that's for anyone who's actually involved in any kind of food service for older people, so that you can share best practice. It's just a way to it's just a way to ask questions, share what you're doing, share research. It can be quite practical sometimes, it can be about policy. So it's just recently gotten off the ground, and if anyone is involved in that kind of work or is just interested in that kind of work, please do go to our website and sign up, and we can hear about the work that you're doing, and you can ask questions and all of that kind of thing. So I'm going to stop sharing my screen now and hand back over to Abby for the last little section.
Thanks very much. I think my only job really at the end is to say thank you. So say thank you to all of our speakers for sharing their fascinating research, for sharing the insights from the work that they've been undertaking, and for sharing their personal experiences. I think all of those have really, we've all learned something, we've all heard some new things. I think we've all got quite a lot of food for thought to take away from today. I'd also like to thank the organisers, and particularly Simon, for keeping all of the tech going. I'm trying to look down the screen. I'm looking at Morgan to say I think we'll be sending around all of the presentations and the reports to everyone who's attended, so you'll be able to read them in a lot more detail. And then my final thank you is to all of you for coming, for participating, for contributing to such rich discussions in both the breakout sessions and through the chat, and for making this a really interesting and worthwhile event. So thank you all very much.
Hi, Morgan, can I ask a question before you leave? Can you hear me?
Yes, we can.
Sorry about that. No, I couldn't join that because yesterday I tried to help out an aged